My name is Gretchen Heary. I am the owner and the nurse practitioner at Sirona Family Health Care. We are opening our doors to all insurances and all patients. If you are interested, feel free to, at the end, there is a phone number. It's also listed on this slide to join our group. However, my goal today is to discuss healthcare in the nations that it is today. Um, Inspiration ignites creativity and motivation. It helps individuals pursue new ideas and overcome challenges. It often stems from personal experiences, role models, and exposure to art and nature. Cultivating inspiring environments encourages growth, innovation, and a positive mindset, empowering people to achieve their goals. I want to help use inspiration and the caring mindsets in order to help you achieve your healthcare goals. I follow a philosophy that was designed by Dr. Watson, a nursing innovator, and her focus is based on caring. And I believe that if caring is the core concept of how we do with healthcare, then our people that we care for can be improved. So I challenge you to look into other aspects of caring. But first, we're going to discuss the barriers that make it difficult for people to follow through into the realms of healthcare. Healthcare involves many complexities and barriers. There's the multi-system disease, functional limitations, dependence on technology, um, need for multiple clinical subspecialties. There's fragmented healthcare systems that we go from one place to the other, inadequate health insurance, deficits in the medical care delivery systems, problems accessing critical services, financial costs, family demands, lack of social support, and educational barriers. However, as an NP, our role is to place the patient in the best position to be able to heal and self-heal and actively engage in the caring through authentic presence and intentionality. That means focusing on the person in the here and now, in their caring moment, with everything that they have unconditionally. We do this through caring. Which promotes growth. It accepts the person for who they are and looks at them in what they can be. It can help the person gain control, become knowledgeable, and promote healthy changes. Dr. Watson describes these caring methods through 10 aspects: to inspire, to trust, to nurture, to forgive, to deepen, embracing, co-creating, balancing, ministering, openness, to all to the lead to the focus of wellness together. So I'm going to ask you 20 questions. And I want you to think about how your healthcare system is helping you today. And if you can answer these questions as yeses or nos or somewhere in between. This is going to help you decide if your current healthcare provider or system is actually working for you and bringing you to the best level that you can be. To inspire someone, you need to be authentically present, enabling the faith, hope, belief system, honoring the subjective inner life world of self and others. And it's the capacity to maintain beliefs and to get through adversity. So, the caretakers that you have now, do they honor your own faith? Do they help instill hope and respect in your belief system as part of your care? While in the facility, do your caregivers help support your hope and faith during their care for you. Trust is so important. It's being sensitive to others by cultivating your own spiritual practices beyond the ego self to the transpersonal presence. Do your caretakers encourage you to practice your own spiritual beliefs as part of your self-caring and healing? Do your caregivers, are they respectful of your individual spiritual beliefs and practices? Nurturing involves relationships. It's developing and sustaining a loving, trusting, caring relationship. It's the development of helping trust relationships become the development of helping trusting human caring relations. It cultivates the heart-centered caring relations and honors one another's experiences. With an established intent to care comes an awareness of the fleeting uniqueness of each moment, each situation, and each individual. Do your caregivers have they established a helping and trusting relationship with you during your time there? Does everyone on your healthcare team value relationships that are helpful and trusting? To forgive is to be your authentic self. It's being present to and supportive of the expression of positive and negative feelings as a connection with deeper spirit, self, and the one being cared for. It's authentically listening to another's personal story. A person's consciousness and deliberate decision to let go of resentment helps focus on a current and present moments, and it shows empathy towards the hurt and have the ability to release the negativity. Do you feel like you can talk openly and honestly about what you're thinking because those who are caring for you embrace your feelings no matter what your feelings are? Do your care providers encourage you to speak honestly about your feelings no matter what your feelings are and give you the time to express those feelings? To be your creative self involves creative problem solving, solution seeking through the caring process. It's the full use of self and artistry, of caring healing practices through the use of all ways of knowing, being, doing, becoming. It's a systematic use of scientific problem-solving methods for decision making that become the use of creative problem solving through the caring process. And it strives to continue with authenticity and genuineness through the empathy and skillful self-disclosure, community, and revealing oneself skillfully. As your team, do your caregivers, are they good at creative problem solving to meet your individual needs and requests? Do you believe your healthcare team is currently working with and solves unexpected problems really well? Embracing loving and kindness should be the heart of every interaction in healthcare. It's sustaining a humanistic, altruistic values by practice of kindness, compassion, equanimity with the self and others within the context of the caring consciousness. Every day that you are there, do you see that the care is provided with loving kindness? Overall, is the care that you have received from the staff at the facility, has that been provided with loving and kindness? Co-creation. It involves a healing environment at all levels, the subtle environment for the energetic, authentic, caring presence at all levels, not just physical, but also non-physical. It's the subtle environment of energy and consciousness whereby the wholeness, the beauty, the comfort, the dignity, and the peace are potentiated. Do your caregivers respond to you as a whole person, helping you take care of all your needs and all your concerns? Do you know that your healthcare team will help meet your physical needs as well as your emotional and spiritual needs? Balance is our ability to learn, engaging in the transpersonal teaching and learning with the context of caring relationships that attend to the unity of being and meaning, attempting to stay within others' frame of reference. It's staying within others' frame of reference and shift toward coaching models for expanded health and wellness. It's working together. Do your caregivers teach you something new? Do they teach you in a way that you can understand it? Do your caregivers, are they responsible for how you learn and whether or not you are ready to learn something new? Ministering. It's the reverent assisting with basic needs as sacred acts, taking each moment and making it present, touching the mind, body, and spirit of another with intentional, caring consciousness. We have one identification, and that is being human. And we have an obligation to respect one another's human dignity. Administering human care essential, which becomes alignment of the mind, body, spirit, wholeness, and unity of the being and all aspects of care. Does your healthcare team, have they created a healing environment that recognizes the connection between your mind, body, and spirit? Does the facility and the care providers, have they created an environment that's helped you to heal physically and spiritually? And finally, openness. It's infinity. It's being open to the spiritual mystery and unknowns that allow for miracles to happen. The opening and attending to spiritual, mysterious, and existential dimensions of one's own life and death, soul care for the self and others. Do your caregivers, are they accepting and supportive of your beliefs regarding your higher power, which allows for the possibility for you and your family to heal? Do you feel like if you told your care provider that you believed in miracles, they would support you in that belief? Do they take the time to understand? At Sirona, we practice under the transpersonal caring, which is an intersubjective human-to-human relationship in which caregivers affect and are affected by the other person. They convey the caring moment and the human-to-human connection as greater than just the two people. And it provides and unveils your true thoughts, feelings, and attitudes, and allows us to give more authentically in our relationship and care for each other. Caring is contagious, and it infuses caring energy into others. It invokes awareness and intuition. It's positive and inspirational, and it creates enduring relationships and human connectedness, which we try to expand through Sirona. We want to be the difference. We want to hear what you say and help you achieve your goals. A caring culture can lead to positive outcomes, and that is our goal. We practice with one caring occasion at a time. A caring occasion involves actions and choices by the caregiver and the individual. It's the moment of coming together on a caring occasion that presents the two people with the opportunity to decide how to be in that relationship. At Sirona, we don't believe in telling you how you should behave or what your choices are. It is our goal to educate you into what your choices are so that you can make the most educated decision, and it meets within your mind, body, and spirit holistic health self. We do this by being present in the caring moment. We create a sense of social presence where the patient feels connected and part of the environment. We create a sense of community through our expressions of concern, politeness, respectful, communication, and we use trusting words. We imply empathy, compassion, communication, teamwork, and we are authentically present. By utilizing a caring relationship to help grow, it provides a catalyst to create healthy environments and promote effective collaboration. Dr. Felenz noted, caring and healing cultures are those in which there is a palpable, visible regard for the dignity of human beings, and where relationships between the member of the healthcare teams and the people they serve are built on mutual respect and shared commitment to healing. At Sirona, we don't have as many barriers as the big corporations do. We take the time to see you as a person and as a patient, to meet your goals and healthcare, to become the better well-being of yourself. In utilizing Dr. Watson's theories, there are 4 concepts: the human being, their health, their environment and society, and the caregiver. At Sirona, we try and focus to have these all work together to meet the needs for the patient. Based on these 4, there are assumptions. We assume that caring can be effectively demonstrated and practiced only interpersonally, that caring consists of curative factors that were discussed previously, and that it results in the satisfaction of human needs. That effective care promoter of health and individual for the family and growth, and caring responses accept the patient as he or she is, as well as what they can become. And that the caring environment offers a development of the potential while allowing the patient to choose the best action for themselves at a given point in time. And that the caregiver uses the science of caring as complementary to the science of caring. The practice of caring is central to nursing. And as a nurse practitioner run office, that is our main focus: caring. Together, the caretaker and the one cared for build meaning and understanding based on authenticity, loving kindness, and altruistic concern. By taking the time to knowingly understand your lived experience while being emotionally present and assistant in doing what you could do if possible, and facilitating movement from transition and unfamiliarity while maintaining belief that you have the capacity to work through with a shared vision, goals, and language for understanding, allows our structure for science of caring to continue and to grow. By utilizing Dr. Watson's science of caring, we respect a reverence of life, true happiness, provide loving speech and deep listening, healing, and nourishment to help you meet the goals that you need for a healthier tomorrow. If you feel that your current healthcare provider is not meeting the needs that you need, we are accepting new patients. We provide services that include full family practice care, workers' comp care, wellness visits, health maintenance visits, injury and illness care, occupational health care, CDL and driver's physicals. We can provide patient advocate services or concierge services. What makes us different is that we are caring driven. We provide a holistic nursing focus. We advocate. We can provide in-home visits. We support the right to self-determination. We assist with coordination of care and assist with access to services. We provide empowerment to you to meet your goals. Our goal is to reduce the hospitalization. We want to keep you home and out of the hospital. And we provide emotional support. We can be contacted via stopping by, email, phone number, or our website. Feel free to contact us in either way. Dr. Gretchen at sironafhc.com, 570-225-8760, or check us out on our web, www.sironafhc.com. I hope you find this educational and enjoyable. If your provider is meeting your needs, I'm so happy for you. But if not, I hope that you will give me a chance to help you become a better you. Thank you.